Okay, we're going to get started. Good morning. So on the screen we have the agenda that we're going to be covering today. We're going to be covering the changes for 2021. The medical plans are moving from Aetna to Blue Cross Blue Shield. You have no changes on the dental or vision, and then the voluntary life products and the employer paid life products, disability products are moving to MetLife. The benefit, your open enrollment begins today and will close on November 18th, which means you have until the 18th to submit your changes, your enrollment, or your waivers. The benefits that you're reviewing will start on January 1st, 2021 until December 31st, 2021. In regards to eligibility, all employees that have met the eligibility criteria are eligible for benefits aside from yourself, legal spouse, a domestic partner, children up to the age of 26. As I stated earlier, these benefits begin on January 1st and you're locked in for 12 months on all of the pre-tax benefits. You cannot make any changes unless you experience a qualified event. And on the screen are some examples of that: marriage, divorce, birth of a child, loss of coverage. You have 31 days to notify your HR team that you'd like to review your benefits, make changes, remove coverage, add coverage, things of that nature. If you exceed the 31 days from the date of the event, then you will have to wait until the next open enrollment period to make any changes to your benefits. Next, we're going to go over the plans with Blue Cross Blue Shield. So the first plan here is your PPO 5,000. So this is a $5,000 individual deductible, $10,000 family deductible. And if you meet that deductible, you're going to go into that co-insurance with Blue Cross Blue Shield. They're going to pick up 80% of the cost, and you pick up 20 until you reach that maximum out of pocket. Keep in mind, all services on this plan are going to be deductible first. So your sick visit to your doctor, specialist visit, urgent care, emergency room, and all non-preventative medication. Those are all going to be subject to your deductible first. You can use your HSA dollars to pay for all of those services. Your preventative care and your well woman, well man, well child check, age appropriate exams and lab work, and FDA-approved contraceptives and preventative drugs are going to be free before deductible, so no out-of-pocket costs for those items. If you need to see a list of the preventative drugs or medications, I can send it to you so you can take a look and see where your particular pharmacy falls. All other medications are going to be subject to your deductible first. Again, you can use your HSA dollars to pay for those prescriptions and services. The next plan here is the PPO 6350. 6350 is the individual deductible and 12,700 is the family deductible. Now, if you've met the deductible, you've also met the out-of-pocket maximum, which means you're covered at 100%. Same as the other plan, your preventative care services, age-appropriate screenings, and lab work are going to be covered at 100%. Your office visits, these are going to be your sick visits, your walk-in clinics. It's going to be at a $25 copay. Specialists are $50 copay. Your urgent care per visit, $75, and your emergency room is $250. Now, if you go into the emergency room and you have to be admitted, they will waive the $250, but you will start to pay towards your deductible. Also on this plan, when the deductible comes into play, is major services: hospitalization, inpatient, outpatient, surgeries, MRIs, CAT scans, durable medical equipment. That's when your deductible is going to come into play. On this plan, if you need to go get diagnostic lab work, so blood draws or x-rays, diagnostic, they're going to be at a copay depending on where it's rendered. So if you go into your regular doctor office for blood work, it's going to be a $25 copay. If you go to your specialist for an x-ray, it's going to be a $50 copay. You also have medication available before the deductible. So 30-day retail supply for copays. So typically your generic medication is going to run you at the local pharmacy $4 or more. So the max you'll pay for your generic drugs under this plan is going to be $10. Your preferred brand name is up to $35, and your non-preferred brand name is going to be $60 or $120. And then if you're taking any type of specialty medication, there are 4 additional tiers under Blue Cross Blue Shield for specialty medication. In your summary benefit of coverage that was included in the invite, there's a summary for each of the plans. You can take a look at that. If you have a question as to where your pharmacy falls, I will happily send you over the information for all the pharmacies so you can look it up, the name of the drug that you're taking, and if it's a generic, preferred, non-preferred, or specialty drug. Any questions on these two plans? Okay. The last plan that's being offered here is the PPO 6500. This is using the Alliance Network. Today we know it as the Banner Plan or Banner Network. It is changing first of the year. It's called Alliance. It is very similar to the Banner Plan. So it's going to be the Banner Hospitals, Honor Health Facilities, University Medical Center, Cardin's Children. Those are all going to be included in this network. The other two plans that I went over, those include your Phoenix Children's Hospital and the Mayo Clinic, aside from the hospitals that I already mentioned. So the Alliance Network is Arizona only. However, if you do have dependents away at school or in college outside of the service area or outside of the state of Arizona, they will have coverage under the national PPO plan. So they will have coverage. They will be able to go see providers, doctors, urgent cares, obtain pharmacy outside of the service area. So this is a $6,500 individual deductible, $13,000 family. If you meet that, you've also met your out-of-pocket maximum, which, similar to the last plan, you would be covered at 100% for all services for the rest of the calendar year as long as you stay in the network. You also have the preventative care services covered at 100%. So your age-appropriate screenings, your well-man, well-woman, well-child check, and any any preventative testing that needs to go with that is also going to be covered at 100%. Your office visit to your regular walk-in clinic or physician's office is going to be a $30 copay. Your specialist is going to be a $65 copay. And in all of the plans, you can self-refer to specialists. You do not need a referral from your primary care physician. Urgent care is going to be $75 per visit, and emergency room $250, and the same thing applies. If you're going to have to spend the night, you're going to have to start paying towards your deductible. Same applies for diagnostic lab and x-ray. You're going to pay a copay depending on where that service is rendered. You also have the medication available at the same copays. You're going to pay the lesser of up to $10 for your generic drugs, up to $35 for your brand name preferred. Your non-preferred brand name is going to be either $60 or $120, and then you have 4 additional tiers under that specialty category. Any questions on the 3 medical plans? All right, we'll talk about the HSA next. So you do have an HSA available to you to enroll in. So in order to enroll in the HSA, you have to first enroll in a high deductible health plan, which is a non-copay plan. You also cannot be covered under another under a copay plan. So if you're covered under a spouse's or domestic partner's plan or TRICARE, and you have copays before your deductible, that excludes you from opening an HSA account. So you cannot open an HSA account. Also, you cannot be enrolled in any part of Medicare. You may be Medicare age and not enrolled in Medicare, and you may open your HSA. And then also you cannot be claimed as a dependent on someone's tax returns. Remember, these are pre-tax dollars that come out of your check that go into a savings account, and you can use those dollars to pay for your claims on that high deductible health plan, for your dental, for your vision, for yourself and all of your dependents. And that money is your money, stays with you, rolls over year. If you are already enrolled in a high deductible health plan today and you have your account open with UMB Bank, you do not need to open a new account. That will stay the same. You just need to indicate or tell us how much you want to put into that account, how much of your pre-tax dollars. And of course, the IRS has the limits that they review year over year for the 2021 plan year. It is different. That's what noted here on the screen. It is $3,600 for an individual that you can put into that account, and $7,200 that you can put in as a family. And under IRS rules, a family is going to be 1 plus a child, a spouse, or an entire family. Also, if you are 55 plus, you can add an additional $1,000, making it $4,600 or $8,200. Now, if you and a spouse are on two different high deductible health plans combined, you cannot exceed the $7,200 a year or $8,200 if you're over 55. Again, these are dollars, that's your money, and it goes with you. If you leave the company, you keep that account. There is no use it or lose it provision with an HSA. Any questions on the high deductible health plan or the HSA?
Yeah, I have a question.
Of course.
So if my husband is covered under a different healthcare plan and I'm covered under the one for Donley, can I use the HSA for him?
Yes.
Okay.
Yes, you may.
Okay, great. Thank you.
You're welcome. Any other questions? Okay, next we'll go over the flexible spending account. So similar to the HSA, pre-tax dollars that you can utilize towards medical services for yourself and your dependents. And this particular plan, the FSA, is a standalone plan, so you do not need to enroll in any other coverage to have the flexible spending account. It is a maximum of $2,500 for the 2021 plan year. That's the max that you can elect, and it does have a maximum of $500 rollover. If you have an FSA today and you have more than $500, if on December 31st you have more than $500, you will lose whatever the excess is of $500. So I would recommend spending it down. Also, if you leave the company, this does not go with you, it stays behind. One of the other differences is when you elect your dollars on this account here on the screen, the FSA, it's front loaded on that card, ready to use day one. And then it's deducted from your paycheck for the rest of the calendar year. So again, you can use these dollars to pay for copay, for prescriptions, for eyeglasses, for dental work for yourself and dependents. You also have the dependent care FSA. So again, pre-tax dollars going into an account that you may use to pay for daycare or elderly care. You can use those dollars as they're deducted from your paycheck. You can pay the providers or pay yourself back for those services. Does anybody have any questions on the flexible spending account?
Same question on that. Can I use that for my husband as well if he's not on my insurance?
Yes, if you enroll in the high deductible health plan, we recommend the health savings account versus this plan. But the other two plans, you can enroll in those, or you may enroll in just this and nothing else. And yes, you may use it for your dependents.
Okay, great. Thank you.
You're welcome. Okay. This is information in regards to the telemedicine with Blue Cross Blue Shield. Today it's Teladoc under Aetna. It is changing first of the year to Blue Care Anywhere. So you have medical services, counseling, and psychiatry available 24/7, 365 by board certified physicians. And you could use it while you're traveling anywhere within the US. And starting January 1st, it'll be at zero copay for yourself and any dependent enrolled on the plan. So in regards to the medical, they can diagnose over the telephone, Skype, the cold, flu, sore throat, earaches, UTIs, rashes, and they can prescribe medication to the pharmacy that's closest to you, wherever you are. Counseling and psychiatry, you stay with that counselor or psychiatrist until the treatment is complete, or they refer you out to an in-person treatment for in-person treatment. So it's a really good resource. You'll get additional information when you get your ID card with your welcome kit. It is an app that you can download to your telephone. You can register online as well. So it's a really good resource to use for yourself and your dependents beginning of the year. Next, we'll go over the dental options. So the dental options have not changed from today. So we'll go over those with Delta Dental. So the first plan here is a PPO plan. So this is your traditional dental plan where you have an allowance to use towards your dental services. In this case, it is $1,500 per person enrolled in the plan. And then you get an additional $1,000 to use towards child orthodontia, and that's a one-time lifetime benefit per child. Your preventative care services are covered at 100%. Your cleanings twice a year. You can space those out any time during the calendar year. Also, if you have any type of coronary heart disease or are pregnant, you get a third cleaning at no cost to you. And it is on the honor system, which means you just tell your dentist that you're eligible for that third cleaning. You don't need to provide medical information. And then basic services such as a cavity, emergency services, or emergency extractions, those are going to be covered at 80%, and you're responsible for 20%. Major services, endodontics, periodontics, root canals, crowns, things of that nature is covered at 50-50. Now, if you utilize the basic services or the major services, you're going to be subject to a one-time deductible of $50 as an individual and $150 as a family. And you only pay that once in a calendar year. If you never use the basic services or the major services, you will never have to pay that deductible. The next plan is a DHMO program. No changes to this either. On this plan, you do have to designate a provider. You may change that provider as many times as you would like during the year, and each person enrolled in the plan may have their own provider as well. Once you designate the provider, you can go, your services, your preventative care is covered at 100%, 2 cleanings a year. Additional cleanings are going to be $40. On this plan, there is no deductible and there is no annual maximum. All services are on a fee schedule. This plan does include both child and adult orthodontia, and it includes dentures, endodontics, root canals, everything that you can imagine that you have done at a dentist is going to be covered. And the way it's covered is with a fee schedule. So here on the screen, you'll see some examples. This is also was included in your in the invite. So the first thing you see is a diagnostic. There are no costs for that. And as you thumb through that multi-page document, you'll find all the dental codes. If you want to see what a treatment plan for you would cost, if you know what you need to get done for next year, you follow that along, and that's your out-of-pocket cost. It's not a benefit towards the service, it is your out-of-pocket cost. So again, it does cover child orthodontia and adult orthodontia. You see that listed on the screen here. And just depending on the age and the type of procedure it is, it could be anywhere from $1,150 down to $2,100 for adult orthodontia. Again, you do have to designate a provider. If you don't designate a provider, Delta Care USA will designate one based on your home zip code. But again, you may change it either by calling the 1-800 number or going online and designating a new provider. Any questions on the dental? Okay, Delta also has a website and a mobile app, so you can use either one to find dentists, have your ID card, and see how much of the plan that you've utilized to date. The vision plan, no changes to the vision plan. It stayed exactly the same. And no cost difference either. So you have your exams every 12 months for a $10 copay, and it is a full 12 months between eye exams. So if you got your eye exam sometime in September, you'll have to wait until September of 2021 to schedule that eye exam. The frames are covered every 12 months, and you have a $120 allowance to use towards those frames, and then a 20% discount above 120. And then your plastic lenses, single vision, bifocal, and trifocal are going to be covered with a $10 copay. Your contact lenses in lieu of the lenses for your glasses is at the $80 allowance, and then 15% discount above the balance. Medically necessary contact lenses are going to be covered in full. When searching or navigating through the website for iMed, make sure to select the Insight Network. There's additional information both in a flyer and in your benefit guide on how to navigate and find a provider. Questions?
Can you go back one screen just so I can get the information on our, just 1 second. Thank you.
You're welcome. This is also available on in your benefit guide that was part of the invite. So all of the website, etc., is going to be available on there too. Any questions?
I actually didn't get the benefit guide.
Okay, I'll make sure to send it out with the link to the YouTube video.
Okay, thank you so much.
You're welcome.
Can that just be sent to all of us?
Yes, it will. I'll send it to everybody on the invite. And then if somebody doesn't get it, you may forward as needed. Okay. Voluntary life and accidental death and dismemberment, that is changing to MetLife beginning of the year. So the company will continue to provide a $10,000 life and AD&D benefit for all eligible employees. Aside from the company paid life insurance, you also have access to voluntary life. So if you're enrolled today in Unum, you will have to complete a new enrollment form through MetLife, and I can go over that form with you. It is the same, so 5 times your annual earnings up to $500,000 guarantees you for the employee. And then your spouse may also have life insurance in the children. The guarantee issue remains the same at 5 times base annual earnings up to $200,000 for yourself, $25,000 for the spouse, and $10,000 for the children. And also an enhancement to this program on the voluntary life, there is no reduction of benefit. So if you enrolled for $200,000, that's going to be what the value of your life policy throughout, until the expiration of the policy or it's utilized. So there's no reduction in that. And I'll go over the form to let you know what needs to be completed, both for the beneficiary, for the company paid life, and the voluntary. Same thing applies to the short-term and long-term. It is also moving to MetLife. So if you're enrolled today and you want to continue to be enrolled under MetLife, there's a section that you'll need to complete in that form, and I'll go over that. So just going through the short-term disability, it begins to pay after the 14th day of sickness, hospitalization, or illness, and this is off-the-job coverage. So the benefit pays up to $1,000 a week, which is 60% of your pre-disability earnings that are now going to include your base salary, commissions, and bonus. And the duration of the short-term disability is up to 11 weeks. There is a pre-X limitation clause that I'll go over shortly. The long-term disability starts to pay at the 90th day or the termination of the short-term disability policy. Again, covers 60% of your pre-disability earnings, which is base, commission, bonus, and it pays up to $7,500 a month. Now, this plan does last until age 65 or Social Security retirement age. Now, if you're enrolled today on the Unum short-term or long-term disability, you have already met the pre-X limitation. If you're enrolling for the first time, the pre-X will apply. So it's if you are diagnosed, saw a provider, or took medication 3 months before the effective date for a condition in which you go on leave in 2021, it will not be paid. You'll have to wait for the full 12 months for that. If it's something completely unrelated, it will be paid. Any questions on the short-term disability or the long-term disability? Okay. The Employee Assistance Program. So the EAP, you have two to choose from or utilize, and you can use them both. The first one is Support Link, and this is for all employees and all dependents, regardless if they enroll in the benefits or not. So you get 3 face-to-face visits or consultations per issue, and this is again for all dependents as well. It's 100% confidential. No one gets any reporting on who is calling or why they are calling. Also, if you visit the website, the mysupportportal.com, you'll find other resources there available, self-help videos, also some discount programs, concierge services for yourself and your dependents. And then the second EAP program is through MetLife, and this is because of the employer-sponsored life insurance. You get also the consultation, the 3 face-to-face per incident, but you get additional services with MetLife. You get the funeral assistance, will preparation, planning services, grief counseling. You get a lot more services with MetLife. In addition, you get travel assist, and this is if you should travel outside of the country, 100 miles away from your home zip code. You get the travel assist service if you lose your wallet, your passport. They may help navigate through that. Also, if you find yourself in a foreign country and need medical attention, it's a good number to call so they can guide you and get you the assistance that you need. Any questions on the EAP? Okay, Aflac. So we still offer Aflac. We're going to offer a little bit different plans now. So today we offer the traditional Aflac policies. Moving forward, we're going to offer a group policy. And if you're enrolled in Aflac today, I would recommend that you contact our Aflac representative, or they may be contacting you to review your policy and see if they can save you some money coming onto the new Aflac policies. So you'll still have the accident policy that covers you on or off the job, things as small as a paper cut and as big as broken limbs. All of these policies are going to be at a guarantee issue, which means no medical underwriting for all of these policies. So the hospital policy is now pays for as soon as you walk into a hospital to the door. It's got a lot more coverage. The critical illness policy is now tied with the cancer policy, so it's one policy now, and it's got an immediate payout of either $15,000 or $30,000 upon diagnoses of cancer, stroke, coronary heart disease, any of those major things that nobody wants to get. Again, these are indemnity products, which means they put the money in your pocket. It doesn't go to the hospitals, it doesn't go to the doctors or the insurance companies, it goes straight to you. Also, they have a wellness benefit built in, which means if you go get your annual exam, you get a $50 payout from Aflac. If you're enrolled today in Aflac and you already went to get your wellness exam, teeth cleaned, or eye check, you may have money sitting there. So I would recommend also contacting Aflac so they can help you submit those claims. All right, healthcare. So no changes to this plan other than it went up $1.40. So now it's going to be $11.66, I believe, per pet, and then it varies on how many you have covered. So it covers all pets, all breeds, with the exception of fish. There's no pre-X limitation. You can go to the website. There's a flyer also. You can go to that website, punch in your zip code, and see if the veterinarian that you use is already part of the United Pet Care Network. Great discounts there for the pets on checkups, vaccines, medication, just a lot of different things that you can take advantage of through the United Pet Care program. Legal Shield and ID Shield is also available, and you do have to enroll on the website for these services. The Legal Shield is a suite of attorneys that are there to assist you. They do have 24/7 emergency services. They help with also with living will preparation, power of attorneys, contract review, and then you have also a huge library of legal documents to choose and use at your disposal. Identity theft is just that protects you, monitor the credit, the web, make sure no one's out there trying to use your information, your name, and assume your identity. And if you become a victim of identity theft, they help in the restoration of your identity. Any questions on anything so far? Okay, well, we're going to go back to the Aflac because I didn't realize that Jose was on the phone, our Aflac representative, and he's going to speak better to these plans than I can.
Good morning, everybody. Thank you, Leticia.
Sorry,
I was
Jose.
like, it's all right. So,
Too early.
no, like Leticia was talking about, so Aflac has introduced the new coverage. So some of you might have had the Aflac plan in the past. So the accident policy, just to speak a little bit more on detail, it has been improved tremendously. This one is all of these plans are voluntary for you and your family, meaning that it will automatically protect you and your kids, depending on your family tier, single parent, two-parent family, whether it's one child up to, any dependent children up to the age of 26. But the benefits come back to you in case of a serious, sickness or any injury. So some of the plans were, best in class and combined, and they've improved the benefits. So say like the accident coverage has gone up to cover up to $1,250 for the first night in the hospital for any type of hospitalization due to an injury. So that one automatically comes in. You get $300 daily after that, and that's towards any admission and ongoing hospital stays. If heaven forbid there's an intensive care stay, that pays $400 daily. Any major accident or injury seeking treatment to an urgent care is $200 when you walk in. Any major diagnostic testing, MRI, CT scans, same 200. So those benefits all add up. It just, depending on the sequence of how bad or how severe the injury is. So again, it doesn't have a limit. It's per family, per family member. You just, it's per event. There is an additional $50,000 accidental death policy built into it. So that's a new improvement. What we've done is try to combine the best of all the old plans in this new plan and at the best rate possible. So you're probably going to see some significant savings if you compare the plans. Again, this one is a whole family coverage. Same thing for the hospital plan. I'm going to skip the short term here, but the hospital is a $2,000. Just like Leticia said, it's guaranteed issue. So if you had a pre-existing, if there is some kind of, hospitalization due to a sickness or an injury, we don't coordinate. We don't coordinate with your major medical. So whatever medical plan you have, even if you don't take the medical plan now, you may be your spouse's, you still get the coverage, you still get the benefits. So the hospital plan will pay $2,000 per insurer, so per family member per calendar year, just for being admitted to a hospital bed. If you have both the accident and the hospital plan, and they both pay due to an injury hospitalization, you receive both benefits. We do not coordinate with any carrier. We don't coordinate with our own plans either. So you can have 1, 2, all 3 plans, all 4 plans if you want. You don't have to have any of them. These are all voluntary. There's additional benefits for being admitted to the hospital. So $200 daily, $200 for intensive care. Again, these are all, after the event. There's a pretty significant increase on the benefits at a very low cost. The one that we were most excited was the combination of the critical event plan, which is the critical illness plan, which is the heart attack, stroke, cancer, sudden cardiac arrest, kidney failure, major organ transplant, and it includes cancer now. These were 2 separate plans, so you probably have the old version, you probably have one or the other. This has now an up to $30,000 maximum benefit for you as the employee, and up to $15,000 maximum for your spouse. It is age banded, but the cool thing is blended. So regardless of tobacco use and regardless of pre-existing medical. So if you've ever had any concern, heart disease, cancer history, either side of the family, please look over this plan. We can decrease the amounts, right? You can go 15, 30, but those are significant lump sum amounts that will come if there is an initial event. There's additional coverage. There's no lifetime maximum on these. Once it occurs, there's a calendar year separation every 12 months, and then the coverage is fully portable for you and your family. So again, children are under 26 automatically get the coverage at no cost. And then you touched on the disability earlier, Leticia. So our disabilities are 3 or 6 months that you can pick up. 0.7 or 0.14 elimination. This is a little different from the group plan because you can customize this one based on your base income, your gross salary income, and you can pretty much cover. You can layer up, or you can have a faster payout within, immediately after the day of an injury. The other plan pays after 14 days. So it's an optional plan, very well rated, individually, base. You can pick up to your maximum benefit, or you can scale it down and customize it to your, budget. So these 4 plans, guys, we wanted to highlight these. We're working with Leticia and her team. So if you have any questions, please fill out the form, reach out to me. We do have a link, an email, phone number. Either myself or one of my agents will help out, go over. If you had the old plans, we do have to speak with you. We want to make sure that you understand the difference, the cost, and if there's any claims, any outstanding. This will be effective January 1st. And then you'll have access to, the new coverage. If we have to convert them, there is a form we have to, make the changes on. And we want to make sure that you understand all the details on them. But there's a time trade, and Leticia's kind of going over. You can pick a date. We have available times for next week. Just go on the link, And then, we'll be scheduling a phone call with you, going over the details and answer any questions. Again, these are guaranteed issue, pre-existing. Aflac pays cash back to you, and we don't coordinate. So thank you, Leticia, for letting us come back on and let you continue.
Thank you, Jose. So that form that I went over, I'm going to send to Ken so he can distribute to everybody. You can set up your appointment, complete it, and send it back, and then you can have your one-on-one with the AFLAC representative. I'm going to go over the forms that are required. So this is your enrollment forms. This is what we need from everybody, either an enrollment form or a waiver. Everyone must complete. Just complete the sections. If you're waiving, we do need a reason on section F and then a signature. So this is the one form we need back from everyone, no exceptions. The next form we need back from everyone, no exceptions, is the employer paid life beneficiary form. So it looks like this. Again, your personal information here, and then your beneficiary information here, and send it back to us. Those are the two pieces that we need back from everybody. If you're not enrolling in anything else, you're not doing any of the voluntary products, you're not doing AFLAC, you're not doing the short-term or long-term or the voluntary life or anything else, those are the two pieces that we absolutely need back from everybody. We do need everything back by the 18th. If for some reason you are unable to complete the information, please send us an email so we know that it's, when to expect it. Again, and the FSA, flexible spending account. So those of you enrolling in the flexible spending account, it does require an annual enrollment. It does not roll over. The HSA does roll over. You do not need to re-enroll in the HSA. The FSA, you do need to complete the form year over year. Okay. Any questions on anything we've gone over today on the forms or anything else that you'd like me to review?
Quick question. So on the HSA, unless you're changing contributions or things like that, there's no form to fill out.
That is correct. So the contributions you're going to indicate on your enrollment form, and that we will know that will start January 1.
Thank you.
You're welcome. Any other questions? Okay, I will send out the YouTube link along with all of the documents that I went over and all the items, so it can be distributed to everybody. If you guys have questions or want to see any additional information, please do not hesitate to reach out to me. Thank you, everybody, for your time.
Thank
Have
you.
a great day.